Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana. If you're new here, if you are not, thank you so much for coming back. Today is Monday, March the 8th, and I know last week we didn't talk much about coronavirus. Unfortunately, it's still a thing. There are vaccinations going out across the country and across Alabama, and one of the biggest questions we've gotten here at AL.com through our emails, our social media, and just reporters directly is about the vaccine and its safeness for people who are pregnant, people who are in their early stages or later stages of pregnancy, those who are breastfeeding, or those who want to become pregnant. We've gotten questions about all of those things pretty much since the vaccine became available in late December, early January for people in Alabama. So we heard you. We wanted to answer you. Today, I am joined by Dr. Sukhkamal Campbell. She is an associate professor at UAB Medical School and also the director of Fertility Preservation Services at UAB. She is here today to answer all of your questions about fertility, breastfeeding, and everything regarding the COVID vaccine and the relationships between those two things. So I've got some questions here. I'm going to be reading to Dr. Campbell, and we're asking her, if you have questions, please drop them in the comments. I will watch them as they come in, and we will do our best to answer them. So Doctor, thank you so much for taking some time answering these questions. I know this is a hot topic for people right now.
Definitely. Thanks for having me. Can you hear me? Sorry.
Yeah, it dropped out for a second there. Is this the working from home life? Unfortunately, somebody call Spectrum for me. I would appreciate it. But otherwise, Dr. Campbell, thank you so much. I know this is something you've been getting a lot of questions about yourself.
Yes, for sure. This is definitely a hot topic, and we want to make sure people have, accurate and helpful information to make a good decision.
Absolutely. So, Dr. Campbell, let's just get right into it. And the first question that everybody wants to know is, if I am pregnant, can I go get the COVID vaccine? We know that there are over 1 million Alabamians who are eligible for their vaccine at this point. There's going to be more coming in the next couple of months. So there's a lot of people who are pregnant falling into that group. Is it safe for them to get the vaccine?
Yes, that's a very definitely one of the biggest questions that we get every day. Women in all stages of pregnancy, first trimester, towards the end, prior to delivery, is it safe for me to be vaccinated? And our kind of overarching societies, the American Society of Reproductive Medicine, ACOG, which is kind of over all obstetricians and gynecologists, as well as SMFM, which is the Society of Maternal Fetal Medicine, kind of all agree and provide guidelines saying that women who are pregnant or trying to conceive who are offered the vaccine should be included and offered it, just like other people who are not pregnant. They should also be included and offered the vaccine. So definitely, just because you're pregnant, that doesn't mean that you're excluded from getting the vaccine.
So when you say you're not excluded from getting it, does that mean that it's medically safe to get it?
So our data so far, although it is limited, we don't have very, really big studies in pregnant women right now. The data we do have is showing that it is safe for women who are both trying to conceive and those who are pregnant to get it. We don't have any reason to believe that it would be harmful to the pregnant mom or to the fetus. So we support at UAB that women who are pregnant and desire to be vaccinated be offered it and allowed to be vaccinated.
Question coming in from Van Treese. She says, is it safe for those who breastfeed to get the COVID vaccine?
That's also a really good question. As a breastfeeding mother myself, I had to think about that, before getting the vaccine. And the type of vaccine that we have is an mRNA vaccine. So it's not a live vaccine such as the chickenpox vaccine or MMR, which are both types of live vaccines that we don't recommend in pregnancy. The COVID vaccines that we have are all mRNA vaccines for Pfizer and Moderna. And those types of vaccines are kind of absorbed and eaten up, chewed up by the body before they would ever get to the placenta or get to the fetus. We do think that women who are breastfeeding can get the vaccine and maybe pass on antibodies or protection to their baby through the breast milk, but we don't feel that there's any harm from the vaccine itself, that it is passed to the fetus or to a breastfeeding child.
That's interesting. So there could be some benefits to those who breastfeed and get that vaccine, more benefits than the negatives.
Exactly. Yes, that's what some data that we have so far is showing that there's a potential for passage of antibodies or passive immunity to the fetus, to the child who's breastfeeding.
That's so interesting. Is that the same case for a fetus, for a woman who is pregnant? If they get the vaccine, could that immunity carry over into their unborn baby?
Potentially it could, yes. We don't think that the vaccine is passed on or products of the vaccine are passed on because of the makeup of it. It's kind of absorbed through the body of the pregnant woman. It doesn't pass through the placenta, but potentially the antibodies could be passed on to the child. Something to definitely study more about.
You made a comment a minute ago about Moderna and Pfizer being those mRNA vaccines that we've heard so much about. And you made a comment that the body of the recipient of that vaccine kind of eats up that vaccine pretty quickly. So is there an advantage of getting one of these mRNA vaccines like Pfizer, like Moderna, over that newly approved Johnson & Johnson vaccine?
I need to learn more about the Johnson & Johnson vaccine and how it was kind of made up and how it's different from the other two. But in general, we are just recommending that if women are offered any of the 3 vaccines, that all 3 of them are safe and all 3 of them are beneficial to patients and potentially protecting them and their children from COVID.
I have a good question here from Pamela that I think is interesting. She says she had COVID while she was pregnant. She delivered her baby safely, and she wants her baby to be tested for antibodies. She said that has not happened yet. But have you seen anything happening like that? Can babies be tested for antibodies?
I have seen adults being tested for antibodies. I think we're still working on improving our testing, to make sure we're looking for the correct things. Some people have kind of waning immunity as the time from their COVID infection kind of goes away. As we get further out from their infection or their vaccination, the immunity may be changing. And so I think currently we don't have maybe the best test to look for antibodies, but I have heard of testing for antibodies in adults. I'm not sure if it's available in children though.
So that might be why, Pamela, you didn't you weren't able to get your baby tested. But that's an interesting question. I'd love to know if data comes out about that. Quick question I will address. This is all pregnant people are not eligible for the vaccine at this point. Right now, the eligibility, you can find more of that on AL.com, but the eligibility is really 65 and older, and then other groups of people. We've got healthcare workers, first responders, grocery store workers, etc. So we can get that info for you here. We'll leave a link to who is eligible and who is not. But the eligibility is expected to increase in Alabama in the next couple of months. Question here from somebody who said they joined late, and they said, what did Dr. Campbell say about COVID being passed through the placenta?
So potentially women that have COVID during pregnancy, they will become very ill. We think that women who are pregnant will become more ill than maybe someone who's the same age, same health status as them that's not pregnant. And the severity of the illness could potentially cause them to require a ventilator or require more support than someone who is not pregnant. And infection potentially could be passed on through the placenta to the baby as well. That would require testing of the placenta and of the fetus, after birth, basically. We don't think the COVID vaccine can be passed through the placenta, but potentially the virus could be.
That's interesting. So it's not mutually exclusive. The virus might be able to be passed through, but the vaccine will not be able to be passed through.
Because we think it's kind of digested by the recipient's body before it would get to the placenta and not pass through.
That's interesting. Got a question here from Tony, and he says, is there a collective database for pregnant and nursing moms to report what they're seeing, to almost have a forum about what their effects have been like and what information is there for those moms?
That's a really good question. So I know that currently we don't have that sort of setup at UAB. We do, if you are vaccinated through UAB, you will get a survey asking, 24 hours after the vaccine or maybe 2 weeks after, if you fit into any of those categories, pregnant, nursing, trying to conceive, and side effects that you may have experienced from the vaccination. Hopefully in the near future, UAB as well as Pfizer, the CDC will be working with pregnant women directly to study them, as patients and recipients of the COVID vaccine, to look more closely into that population and see how the vaccine impacts them and how, the side effects impact them as well. So hopefully more to come soon.
Doctor, I think especially when these vaccines were first approved, first put out there for people to begin taking a couple months ago, there was not very much information for people who were pregnant or wanting to become pregnant about if they could get the vaccine. And I think that lack of information really led a lot of people to say, well, I probably shouldn't. If I'm pregnant, maybe I shouldn't get it, just because there wasn't a lot of information saying that they should or should not.
Right.
Did you see the same thing? And what can be done at this point to really get that message out to tell pregnant people wanting to become pregnant, breastfeeding, that yes, it is safe?
Yes, I think that's a huge part of it. We want to make sure women have accurate information so they can make the best informed decision for their themselves or their families based on their risk factors. So I'm thankful for the recommendations from our societies, ASRM, ACOG, SMFM. They kind of all say the same thing, basically that the women who are offered the vaccination, so people in high risk categories, maybe healthcare workers or those who are at high risk of exposure, it doesn't really matter if they're trying to conceive or pregnant, they should be offered the vaccine. We think it's safe based on the limited data that we have because it is an mRNA vaccine. It's not a live vaccine. We think it's safe for them to get it in pregnancy. There are some newer recommendations regarding the timeline of if you are trying to conceive or if you're undergoing procedures such as an embryo transfer or an intrauterine insemination. There are newer guidelines saying that maybe it's better to wait maybe 3 or 4 days after that procedure is done before getting vaccinated, so as not to confuse symptoms of the vaccine, as symptoms of surgery. That's kind of newer information that's coming out, but in general, we feel that it's safe for women who are eligible to get the vaccine. And it's important for them to have conversations like this with their doctors, with their families, with their coworkers, to fully assess their personal risks and personal benefit of the vaccine. But in general, we do think it's safe.
Would you say that those women who are undergoing an embryo transfer, an IUI or IVF, that they speak with their personal doctor before making that decision, before just going out and signing up?
I think that would be probably the most beneficial, so that they're most informed prior to making that decision. There's the risk that's causing some of those guideline shifts or new changes in the guidelines is not for fear of safety of the vaccine, but more so because of side effects from the vaccine. There's a small number of patients that may get a fever or may get body aches or fatigue from the vaccination, especially the second part of the vaccine. And so if let's say they had surgery on Monday and then they got the vaccine on Tuesday and then developed a fever or body aches or chills, it would be hard to kind of negotiate and understand, is that a post-operative complication, a post-embryo transfer complication, or is it related to the vaccine? And so that's where that guidance is coming from as far as timing. And I think it's important for patients to talk with their, gynecologists or their fertility providers in order to learn more about that.
That's interesting. It almost reminds me of, especially this time last year, we know coronavirus hit Alabama, but it was that time where it was spring allergies. We still had people battling the flu. And it was kind of a similar circumstance of people saying, are these coronavirus symptoms? Are these allergy symptoms? Are they flu symptoms? So that's an interesting parallel there, Doctor. Question from Kristen to change topics quickly. She said, I've heard that other states are allowing pregnant women to get a vaccine. And Kristen, first of all, there is nothing in Alabama currently that allows anybody that's pregnant and does not fall into a group of people that are approved to get their vaccine to be eligible. We don't know if that's coming. Maybe it is. But Kristen wants to know if you think that that Alabama will allow pregnant women to get in line to get their vaccine specifically as a category, like we have healthcare workers, like we have grocery store workers.
Mm-hmm. I'm not sure if that's coming, but I'm hopeful that it is, because I do feel like pregnant women are at a higher risk of getting severe COVID infection. And we do have some data that shows, increased risk of requirements of hospitalization, of ventilator use, of ICU admission, preterm delivery due to the severity of COVID infection. And so I would hope that pregnant women, can become their own category, because in a sense, they are at higher risk than other women their age in the general population who are not pregnant. So I would hope that they would be eligible on their own to be vaccinated to protect themselves and protect their pregnancy.
Does that mean that pregnant women should be a little bit more careful than the rest of us are when it comes to precautions about coronavirus?
I would say so. I would say if I were pregnant, I would want to be sure, to be socially distant and make sure I'm always wearing a mask when I'm around other people, because it will not only protect from COVID, but during flu season will protect against other infections like that could also be more harmful during a pregnancy, more severe during pregnancy.
Should women who had coronavirus either before they got pregnant or when they didn't know they were pregnant in those early stages, should they be concerned about any effects on their baby? And if so, is there a way to check that?
I don't think there's a way to check that right now. I would say that if they're healthy and feeling kind of back to baseline, have their health back to normal, then hopefully there would be no long-term impact on the fetus. But I don't think we have that data yet. We're still learning so much about this. It feels like things almost change daily at times. We get new data and new information every day about the virus, about vaccination, and long-term effects.
Question from Olivia. She says, is there any data about children who have been born after their mothers had the vaccine?
I'm not aware of any of that data. Hopefully it will be coming soon, though.
You talk about this information that is changing almost daily, and we've seen that for a year now. We've seen that be changing about the virus, about things that you should and shouldn't do, and most recently we've seen it about vaccines, about eligibility, where you can go. I think we've all had a friend or a family member who has dealt with issues in trying to find a vaccine.
Right.
So about the changing information, do you see anything that could change within the next several months, we'll say, that would alter yours and other fertility and OBGYNs about the safeness of the vaccine?
That's a really good question. We want to be sure that we're giving women helpful information, right? Hopefully something that we don't come back in a few months and change our mind and say, whoops, that was wrong. I feel that the data that we do have so far has been very reassuring. For instance, there were several women that were in the initial Pfizer studies for the vaccine that ended up getting pregnant. They were not pregnant at the time of the first vaccine and got pregnant before the second vaccine, and then, basically served as a pregnant patient in that study environment. And there were equal rates of pregnancy in both women who had placebo as well as women that were exposed to the vaccine, with no harmful impact related to the vaccine. And so that I use that data, even though it's minimal, to kind of encourage my patients and to help counsel them that even though the data is limited, what we know so far is that women who got the vaccine had similar fertility rates as those who did not get vaccinated. There was no harm to fertility that we found, and I'm hopeful that will continue as we learn more about the vaccine. And then additionally, since it's not a live vaccine, it's safe in pregnancy, and that's not something that would change. It's the same mRNA vaccine that we're using now and we'll use in the future. And so I feel that is a safe statement that hopefully will not change moving forward.
Kind of going along with that answer, I've got Lindsay asking about studies, and you kind of just mentioned this, but we know that there was a limited amount of data in these vaccine trials with pregnant women and just about fertility in general. So is it safe to say that the data and the studies are limited just because it hasn't been enough time? It's only been a year since this virus hit Alabama?
Yeah, I think that's a huge barrier that we have so far, is just, the extent of time since all of this kind of started and how novel it is for everyone that's, involved, patients, providers. We're all learning so much about it. I do know that there are upcoming studies, though, that will specifically be including pregnant women through Pfizer, through the CDC, the Society of Maternal Fetal Medicine, that will, seek out pregnant women so that we know more concrete data about how they respond to the vaccine.
A question from Lindsay. She says, is it accurate that pregnant women who contract COVID are at risk for premature labor?
Yes. Mm-hmm. Due to the severity of their infection at times, for maternal safety, for maternal health, preterm delivery may be medically indicated. Also, just from being so ill, we know that when women, are pregnant and get so ill that they're requiring a ventilator or requiring supportive measures to keep them healthy and keep them living, that has a significant impact on the fetus and, could cause preterm delivery or lead to a medically indicated preterm delivery due to severity of infection.
This has been wonderful information, Doctor. For people who want to read more, who want to learn more about the studies that are available, and who want to see some of these larger organizations that are saying that it is safe, where should they go? Where can they find more information on the topic?
Yeah, I would say that it's really helpful to look for information and guidelines through the American Society of Reproductive Medicine, through the American College of Obstetricians and Gynecologists. So that's ASRM and ACOG. They both have very clear guidelines for, that population of patients who are in that fertility age range, maybe trying to conceive early pregnancy, to help guide them and to help give accurate data, objective data on what we know so far that may be beneficial for informed decision making. And always, reach out to your doctor, and hopefully they can meet with you and provide patients with answers to their questions so that they have accurate information to make their decisions.
Doctor, thanks so much for coming, spreading this information. I also would be amiss if I didn't mention that today on AL.com, we're honoring our healthcare workers who have worked through the last year to get us through the pandemic. So thank you for that as well, Dr. Campbell. We appreciate you and all of our healthcare workers here in the state.
Thank you so much for having me.
Thank you, Doctor. Everybody watching, thank you so much for tuning in. We'll see you tomorrow.